I've worked in diabetes for 24 years. I started off working in the hospital and then moved to the community where I joined the community diabetes team. This is an advisory service where we offer advice, support and education to other healthcare professionals with their complex patients with diabetes. So part of my role is offering education to patients newly diagnosed with diabetes. This is the start of their journey with diabetes. And I'm also able to see them again in primary care, where we can help them with the lifestyle changes and treatment escalation. I also support the community nurses as well and see their housebound patients and support them with their day-to-day diabetes. So it's always really important not to inject the pen straight from the fridge, to allow it to reach room temperature, as it will make the injection more comfortable. Ensure that you use a clean needle with every single injection, as they do damage quite quickly. It's also important to rotate injection sites and avoid any areas that have become bruised or any lumps that you may have. So making sure that you change your needle with every single injection, as this can reduce discomfort. Try not to rush the injection technique. Always press the plunger and hold it for at least 5 to 10 seconds before releasing. Rotate your injection sites, making sure that you avoid any areas that are bruised. Get the pen out of the fridge prior to injecting so that it allows time for it to reach room temperature. So it's really important when injecting a GLP-1 that you remain hydrated. So water is the best source of fluid, 1.5 to 2 litres a day. Ensuring that your diet contains adequate supply of fruit and vegetables to increase your fibre, and also keeping active as well as much as possible. So walking, moving around can increase gut motility. So you might find that you feel fuller for longer. You may find that you're not able to complete a meal. You might find as well that you're not looking for snacks. You're not snacking between meals. Patients report they lose that, what they call food noise, which is where they're constantly thinking about food. You might find that your clothes become a little bit looser, and you might feel that you've gained energy levels. So you should always seek advice if you suddenly develop abdominal pain, especially severe abdominal pain, alongside nausea or vomiting. If you have any issues around the pen device or dosing, and also if you have continued side effects. So side effects could be common, but are usually transient, but if they continue for a long period of time, it might be worth seeking advice. So Wegovy contains GLP-1. Mounjaro has a dual hormone, so contains both GLP-1 and GIP. For that reason, some of the weight loss may be more prominent with the Mounjaro. The pen devices are slightly different designs with slightly different dosing. So whilst there are different lengths available on the market, we recommend the smaller needles, as the needle is just penetrating the subcutaneous fat. It's more about the injection technique than it is the needle size, and the smaller needles have been reported to have been less painful. So the needles are actually very small and very fine. Patients with diabetes that undergo finger prick testing report that it is a lot less painful to inject the GLP-1. I usually advise a dummy run, so by doing a dry injection, so injecting the needle into the skin with the pen device prior to injecting any of the fluid. Always inject at 90 degrees and inject gently. You will find that your confidence will rise after that first injection. So the most important advice to give is always seek clinical guidance before switching. If you do switch, then always start again at the lower dose to the new GLP-1 that you are trying. This will minimize the risk of side effects. So restarting, you may experience a few new side effects, which are usually transient. You might find that you notice a further reduction in your appetite. So switching between GLP-1s isn't a sign of failure. It might just mean that one is better for you than the other.